A'udhu billahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Respected Chairman Sahib and dear brothers and sisters, I'm grateful for this opportunity to talk about a center of excellence, and we just heard a thorough overview of this beautiful project of Fazl Umar Hospital, and the recurrent theme that we're seeing is the word excellence, center of excellence, and I feel that in Jamaat, excellence and Khilafat go hand in hand. So the recurrent theme that you will see is that when there is the hand of Khilafat, when there is the vision of Hazur Ayyad al-Talib bin Asr al-Aziz behind these projects, only then can we call them centers of excellence. So just as Fazl Umar Hospital is a center of excellence, in the same way, I wanted to briefly present about the Masroor Eye Institute in Burkina Faso. So to give a little bit of background, blindness is prevalent throughout the world, as you can imagine. And among the leading causes of blindness in the world is cataract. Cataract is an opacification or a cloudiness of the natural human lens. So it's a process of aging, and it's prevalent throughout the world. And the only treatment for cataract is surgery, where you remove it and replace it with an artificial lens. It's the most common surgery performed in the United States. It's readily available in first world countries. But in underserved countries, there is a legitimate need to provide cataract surgery. And there's thousands, millions who are walking around impaired because they don't have access to basic care to remove cataract. Burkina Faso is a landlocked country just north of Ghana in West Africa. It's a sub-Saharan country. It's the hottest country on the planet. And here's a closer up view of Burkina Faso. Its capital is Ouagadougou, which is right in the center. You will see there north of Ouagadougou is a town called Dori. Dori might sound familiar to you. That is where there was a recent shahadat of many Ahmadis at a mosque a few years ago, and that's a couple hundred miles north of Ouagadougou. Burkina Faso means land of honorable people. It was formerly known as Upper Volta. It's a French-speaking country with a population of about 24 million, and the primary religion is Islam, and the Jamaat is well established. We just heard Hazur's address at Jalsa Salana UK, in which he shared the amazing news of nearly 250,000 baths in the USA, and among the leading countries contributing to this number is Burkina Faso by the grace of Allah. So the vision of Hazrat Khalifatul Masih Ayyad al-Talib bin Asr al-Aziz was to develop a world-class regional eye care facility providing the highest level of care to local populations, a training facility to enable high-level knowledge transfer to local doctors, and a research organization advancing knowledge. So just to give you a little bit of a perspective, there are 5 ways in which you can contribute to eye surgery in the world from a humanitarian perspective. And by the grace of Allah, the Jamaat has done that in all 5 ways. The first way is that you just donate money. You raise money, and then you deliver that money to an existing infrastructure. For example, there are a couple of doctors, non-Ahmadi local doctors in Burkina Faso, and by the grace of Allah, Humanity First was able to raise money, Humanity First USA in particular, and send that money to these doctors, and then they performed eye surgeries. So that is one way that you can contribute to the humanitarian contribution to eye surgery. The second way you can do it is that you could send teams to underserved areas and perform eye surgery. And by the grace of Allah, we've had the opportunity to do that for about 10 to 12 years in Guatemala. And currently Dr. Asma Bajwa Saiba, who's the head of Gift of Sight, she's been going every year, sometimes twice a year, to do this very thing, to go to Nasser Hospital and to provide eye surgery over there. And so we take teams from the United States and we do that, and UK does that, Canada, other organizations in Pakistan, that happens as well. So that's the second way. The third way is that you can create a mobile eye clinic, which was done as well by Germany, where they actually created a mobile eye clinic and sent it to West Africa, to Benin, and they perform eye surgeries. And there are humanitarian organizations that have planes that travel around the world, and they land in local areas, and the patients go on the plane, and then eye surgeries are performed there. The fourth way is that you can latch on to an existing hospital and just set up an eye clinic over there. And by the grace of Allah, Humanity First and Nasser Hospital have now done that in Guatemala. So there is now a dedicated eye clinic there. And there's not a dedicated eye surgeon yet, but there's an optometrist there. And so that is now happening by the grace of Allah. But the ultimate way to provide eye care in a humanitarian way is the vision of Hazrat Khalifatul Masih, Hazrat Allah bin Nasr al-Aziz, which is from the ground up, on flat ground with nothing there, build an eye hospital. Essentially in the middle of nowhere, where there's no access to eye care, and not only provide eye care over there, but make it a training ground for other doctors to learn how to do surgery, and then do research and contribute to the body of knowledge and research in ophthalmology. So this is a picture of the Masroor Eye Institute in Ouagadougou in Burkina Faso. And the visiting doctors were Dr. Mia Khalid Taslim Sahib of Pakistan, Dr. Qasim Mansoor, Dr. Gandhi of the United Kingdom, Dr. Manik. Dr. Imran Masood is spearheading the efforts. He's an ophthalmologist in Birmingham, UK, and he's gone several times, and he's done most of the surgeries that are from visiting doctors in Burkina Faso. And I've had the opportunity now to go twice. So I share this picture because it's sort of like a beautiful example of the spirit of dedication. Sadr Sahib, Dr. Fizad Abdullah Sahib talked about how we should all volunteer. And I give this example, the picture on my right, so when you're looking on your right, I'm standing next to two gentlemen from Burkina Faso. The one on the left is the former Emir of Burkina Faso, respected Saqib Ahmed Nasser Sahib, who has recently been assigned to Benin. And the picture on the right is his son, Saud Iqbal, who's sitting next to a patient. Saud Iqbal is the one in the glasses. And what's interesting about Saud, sorry, not Saud Iqbal, Saud Ahmed Nasser Sahib. What's interesting about Saud is that he went to medical school and he studied to become a nephrologist, a kidney specialist. And then the instruction from Hazur came to build an eye hospital. And so Saqib Ahmed Nasser Sahib requested Hazur permission to seek Hazur's guidance on what his son should do, because he's already become a nephrologist. And Hazur said to change your specialty into ophthalmology. So here's somebody who had already completed his training. And he went back to school, he got into an ophthalmology residency program, and now he's the director of the Masroor Eye Institute, by the grace of Allah. So these are pictures of the hospital, and you have to know that in a center of excellence, you have to have the top quality instruments, and the microscopes that are being used at Masroor Eye Institute for surgery and the slit lamps that we use are world class. They're the same ones that I use on a regular basis in Los Angeles, and so this has been a work of progress over the last 4 or 5 years to get this equipment. And credit for the building of the hospital goes to Majlis Ansarullah UK. They raised the funds for this, and it was under their direction and leadership that this hospital was built. And so here's a portable slit lamp for a patient right before the operating room. And then I just wanted to give you a glimpse of, I'm not sure if this will play. If we hit play on this, if the IT team can hit play, will it move? I'm not sure. Yeah, it will. So here's a video that I took just with my phone, and I fast forwarded it. And this is us giving a tour of the hospital. So here you walk into the hospital. This will take just about...
इस कमरे में हजरत मिर्ज़ा गुलाम अहमद साहब कादियानी मसीह मौद अलैहिस्सलाम 13 फरवरी सन 1835 ईस्वी में
audio overlap happening right now. That's not with the video.
जैसा कि मैंने अभी आपको इसका
So here's the pharmacy we're entering, and you could see the standards of this hospital, how clean it is, how new it is. This is an exam room. There's 3 exam rooms with slit lamp and equipment, and there's patients waiting there. This is where we do the diagnostic checks for the eye, different measurements we do of the eye in preparation for surgery. That is Dr. Imran Saab working with the technician. And so this is one wing of the hospital. And from here, we go into the lobby. And on the other side of the hospital is the operating wing. And so here we're going into the operating theater. There's a prep room. This is where patients are prepped and given medications, drops prior to the eye surgery. And here we go into the holding area right before they go into the room, and then these are the operating rooms. And so this gives you an idea of how it looks. We can press play on this. This gives you an idea of how it looks outside. So you're driving here in Ouagadougou, dirt roads, essentially. And then there, as you enter the gates, you see this hospital, which really stands out as sort of like a beacon. And this video is from a couple of years ago. Now there's a school that's been built next to it. There's also a mosque over there. And so this is sort of gives you a picture of what Masroor Eye Institute looks like. And then in 2024, 327 cataract surgeries took place, and so far 319 have taken place through June. And then this is in the lobby of Masroor Eye Institute is a picture of our beloved Hazur, and this was unveiled at the inauguration of the hospital a couple of years ago. So prayers are requested for the efforts here. We have about 7 to 8 ophthalmologists, by the grace of Allah, in the United States, and our hope is that all of them have an opportunity to go to this hospital, just like there's an opportunity for them to go to Fazl Umar Hospital and to Guatemala. So prayers are requested, and then if there's any questions about that during the Q&A, we could take those. Jazakallah.